Hello, we are the Fallensteins.
Oh, your Bill.
Yeah.
It's Bampa's Bill.
And when he wins it, then I come.
Yeah. And you
It works too.
So we got involved with Mark in January, mid-January, and he had a terminal diagnosis of metastatic lung cancer to the bone. And after a hospital stay and quite a long journey, you were first diagnosed in November 2013, is that correct?
Right. Mm-hmm.
Finally, his course brought him to the point where they were talking about hospice care. So we did an information visit with you, came and discussed that, and then finally, mid-January, you said, yes, we're ready, I'd like to do that. So along with our team of hospice aides and nurses and social workers and chaplain, we worked to get you as comfortable as you could be and get that strength back. Mm-hmm. We made some adjustments with your medications to help with that fatigue and anxiety and some pain that you were having. And then the next thing we know, you were off and running to the casino.
Yep, there we go.
There you go.
And in my case for hospice, I've worked with hospice. I've done fundraisers for hospice, and I think I knew about hospice, but I really didn't know about hospice. And we've had a lady come in and give us a review through her notebook, and it was really well self-explanatory, and it said a lot about it, but didn't say what it really was. And that was, I wish I'd have went on hospice maybe 2 or 3 months earlier than I did. You know, a lot of people got the impression that once you go in the hospice, you're on your dying leg, but there's so much help that hospice can give your whole family, not just me. Not me at all, in fact. It's my wife and my kids one that really get the help from hospice without the running back and forth, getting medications, you know, what you guys do. And I think it's just wonderful. But all I can tell you is everybody's been unbelievably good. I mean, every nurse and every doctor and most of the aides been really, really good.
Well, for me, when they first came in, they bought things for us, like this wheelchair and a porta potty and oxygen just in case, lotions, salves, pads, everything that I wouldn't even thought that we needed. And they even delivered them. They came right here and delivered them.
We spent all our energy doing nothing without hospice. Seriously. Getting dressed, going out of the house, going to where we need to go, then waiting the whole time, not knowing what the next steps are going to be, not being able to plan anything. As simple as it is, last week we went to the Mall of America. We could plan it, and we were able to all meet together and enjoy that day. Whereas if we didn't have this program in place, we wouldn't have that opportunity. We have lives outside of, you know, my family, my sister's family, my mom's friends, her activities she does outside of the home. Same with my dad, he wants to be able to do those activities. It allows us to still have that opportunity, which you don't, again, I don't really sit and think about it at night, but just talking about it out loud, I don't know, I think I would be so worn out if hospice wasn't around.
It is something that really hits you at all angles and in waves. For me, it's really important to have everybody together because I am a very emotional person and I need that emotional support. My brother and I talk a lot about how we're feeling and what's going on. It's hard because I have my daughter to take care of too in my house, but I feel very compelled to be with my father, and that's where I want to be. You know, and he sometimes says, you don't have to do this, Melissa, you know, you don't have to do this or that. And I said, Dad, that's what I want to do. This is where I want to be. So this time right now, we're really taking it in. It's really a blessing.
I was going to mention too about the staff. There's maybe 3, 4 different individuals that came into the home. Every time you spoke to them, it's, you know, they genuinely wanted to help you with whatever issue that was at hand. Even if they weren't the ones that maybe, like, you know, we don't administer with the health concerns, but I'll make sure that they're aware of it and that they'll get a hold of you. And they did. And it's just so nice that you're always being taken care of no matter who comes through the door.
Talking about the compassion, I've told that to my mom. I said, you can see it in their eyes when they are listening to Dad, and they really do. And they listen to him, and when they talk to him, that there's genuine care there. And that's what you want for your loved one, and it is awesome.
To have this experience, much like a day like today, I come down with Graham, we can actually make a day of it, it's enjoyable, it's good memories, and we can come and go as we please. There's not that hospital visits and nurses always rotating in and out. It really feels like I'm not living the last 6 months in a hospital and dealing with nurses. I'm dealing with my dad and my family, which is just so great because that's how I want it to be. And I'm able to have conversations with Dad, have conversations with Mom and my sister. And again, Emmy and Graham and my wife get to come and experience, you know, our time together. That is truly, truly valuable. And we played cribbage all the time. I played cribbage with him once in the hospital. I played with him 15 times here. May not seem like a lot, but it's really big to have that opportunity. And it can be whatever you want it to be, but for us it's cribbage and having malts. And you know, we couldn't do that in the hospital. We really couldn't. So it's very, very great to have this program in place.
Another one of the fun things that we've done when we talk about doing fun things is we made some hand molds.
I can't even wiggle my fingers.
Okay, maybe Melissa, can you get your hand out first? There you go. Yeah. We'll put some stuff in. And look at, it's just, it's so real. And then look at your hands. You got big hands. We were saying. And then we got Emmy and Melissa's are in the other room yet.
Oh, that's wonderful.
But they turned out really neat, didn't they?
Yes, they did. I think that, especially Emmy, of all the people that will enjoy that the most, our granddaughter.
I think so too.
And this is just something you keep.
Yeah,
I might cry. I got to quit looking at this.
Yep.
Thank you, Hospice. Oh, your bell.
Yeah.
It's Bampa's bell.
And when he went, then I come.